Chapter 6, Video 3. Now we're going to talk about mechanical ventilation. This is a ventilator that breathes for a person who cannot breathe on their own. It forces air into a person's lungs, and it's delivered through an endotracheal or a tracheostomy tube. It's important for the assistant to know the meaning of what alarms are what while they're performing care. And what I mean by this is there's different alarms that sound off from a mechanical ventilator. So, and they're different. They're different from machine to machine. So the assistant needs to be familiar with what equipment is being used in the setting they're working in, and they need to understand what the different alarms mean. And if they sound off, they need to know what to do as far as going to get the nurse, get the doctor, making sure that that patient is taken care of according to whatever alarm sound that they hear. There's different reasons for mechanical ventilation. It may be used during surgery and for a period of time after surgery. It may be used for a person taking a great deal of pain medication, especially if they have severe injury or trauma. If they have severe injury or trauma, a lot of times the pain medications will interfere with the patient's breathing, so they'll put this mechanical ventilator on because they have to keep them on high doses of pain medications. And also, you may see it used with people who overdose. If they overdose on a drug, you may see them put on mechanical ventilation for that. If they've had a head injury or a stroke, anything that affects that control center of the brain may not tell the body to breathe. If they have a spinal cord or neurological injury or disorder, there again, that's messing with the communication and telling the brain may not be speaking, and it may not be telling the body to breathe. So it would be used for that reason. Now we're going to talk about chest tubes. Chest tubes remove fluid from the space between the lungs and the chest wall, and they enable the lungs to fully expand. And one thing that's very important to remember with a chest tube, it has to be kept below chest level. So it's hung on the side of the bed below that chest level. And again, it removes that fluid around the lungs, and which allows the lungs to expand. And there's different conditions that require chest tubes. The first one we're going to talk about is the pneumothorax. The pneumothorax is the buildup of air in the space between the lungs and the chest wall. So if we put that tube in, it will simply remove that air. A hemothorax is the buildup of blood in the space between the lungs and the chest wall. So again, if we put that chest tube in, it's going to remove that blood. And then a severe lung infection can cause the buildup of pus and fluid around the lung. And then if we put that chest tube in, then it's going to remove this infection and that nasty fluid. So that chest tube is actually put in, and it's put in to remove that fluid that's around the lungs. There's different things that you need to know when we're caring for a person with a chest tube. We need to make sure that the chest tube drainage system is where it cannot be knocked over. It needs to be below chest level. And we never, ever, ever disconnect the chest tube from the drainage system, okay? Because that would allow air to backflow in and go back into the chest. And this is a sealed system. So what we're looking for here is making sure that whatever's in there around that lung is coming out. If we break the seal on that and we remove something, air can suck back in to that chest cavity and cause the lungs to collapse. We need to monitor these patients very closely, and if we notice anything at all different about these guys, we need to make sure that we notify the nurse or the doctor. Again, we're never going to disconnect that chest tube. We want to make sure that there's no coils or kinks in it. Whatever's in that chest cavity, we need to make sure it's able to flow out into the drainage system freely. And we want to position the patient where they're comfortable, okay? We can use pillows to provide comfort. We may need to keep them from laying on that tube. So whatever it takes to make these guys comfortable, we need to do. A person with a chest tube should maintain which of the following? That would be D. We never raise the chest drainage system above chest level, okay? It could allow that fluid to move back into that chest cavity, which in turn could cause those lungs to collapse again. If you have any questions, please let me know.